Welcome everyone to the coronavirus Q&A here in Evanston. I'm delighted that we have several guests with us today who are known to many of you throughout our district, and that is Congresswoman Jan Schakowsky.
Hi, everybody.
Welcome, Jan. State Senator Laura Fine.
Hello there.
And then we have Andrew Gotchkowski, who is a really important person that everyone may not necessarily know, but helps Congresswoman with all of the federal grants. And as everyone knows, there's a lot of need out there and federal grants coming our way. And so Andrew's a really key person, and we're excited to have you with us today as well.
Thank you.
So this is an opportunity for folks here in Evanston to ask questions of elected officials, of our public health officials. This is probably the fifth or sixth Q&A that we've done. They're generally viewed by 2,000 to 3,000 people are watching these, so we're getting great viewership. Everyone knows that COVID-19 are on the minds of folks. So what I'd like to do is just give everybody sort of a baseline of where we stand right now as a country and a state, and then I'm going to turn it over to our Congresswoman with the first question. So where we stand, and this was as of yesterday, I'm looking at the situation report that we receive every day here in Evanston, produced at our Emergency Operations Center, is over 457,000 people in the country having tested positive. We all know there are many more people that have COVID-19, and we don't have enough tests to test everyone. Over 12,700 fatalities by COVID-19 in the country. When we move down to Illinois, we have 16,422 folks that have tested positive, and sadly 528 deaths. In the city of Chicago, which includes some of Congresswoman Schakowsky's district, we've had 6,619 tested positive, and sadly 196 deaths. And here in Evanston, we have 144 folks that have tested positive for COVID-19, and sadly 4 deaths. I'll throw out one other statistic, which is important because it's our neighbor next door, which is Skokie. And Skokie has had 200 confirmed COVID-19 cases and sadly 7 deaths. So those are the current statistics of what's out there. We'll get into lots of your questions. I know there were questions about PPEs, the protective gear that we have for responders and healthcare workers. But what I'd like to do now is ask Congresswoman Schakowsky to just give us a sense of what's happening in Washington. I know people are very appreciative of the work that you and all of your colleagues have done, Jan, to help us in this really severe situation. And the last CARES Act was over $2 trillion. But there's a lot of people, and I know you feel this way as well, that there's a lot of need still out there. So if you could take us from maybe the last act to what you're all working on.
Okay. Well, thanks back at you, Mayor. You're doing a great job, and I am so pleased that all of us, the state senator, the state legislators, the aldermen, we all are pulling together. That doesn't happen everywhere, and I really appreciate your leadership. So I want to, I'm going to read for a second, because I want you to know what the Speaker of the House and the head Democrat in the Senate, Chuck Schumer, have come up with as an answer to the Republicans who wanted to put $250 billion into continuing the PPP program, the Paycheck Protection Program, which is a very important program. So let me describe how the response and what's in negotiations right now. So the $250 billion in assistance to small businesses, what our leaders in the Democratic Party want to do, that with $125 billion channeled through community-based financial institutions that serve farmers and families and women and minorities and veteran-owned small businesses and not-for-profits in rural and tribal and suburban and urban communities. So to put an emphasis on that money, because, there are a lot of people who have trouble with this PPP program because the big banks want to deal mainly with the people who have a relationship to them. And that's leaving out a number of lenders and a number of individuals who need the small businesses that need the help. $100 billion for hospitals, community health centers, and health systems, providing desperately needed resources to the frontline people in this crisis. And we know this right here in Evanston, that we hear about these shortages and the need for more. Now that's what we call PPE, personal protective equipment, is unfortunately still an issue here in Evanston. The head of the hospital system here, Evanston Hospital, et cetera, said he feels like he is a full-time manager trying to find the equipment. So $150 billion, you're going to like this, Mayor, to state and local governments to manage this crisis, because we know that most of that revenue, that $150 billion we got in the CARES Act, really not a lot has trickled down to the communities, and a lot of us have really been pushing. So this is another $150 billion where we really want to double down on investments in the local communities. And strong additional support for families with a 15% increase to the maximum SNAP benefit. As probably most people know, that's the food stamp benefit to help put food on the table. And I'm also working to get the state to allow online ordering of food and adding more vendors, more retailers to participate in that program. So our people with disabilities and the seniors don't have to go anywhere, but can use on the phone, online, both, to get their food. Those are in the bill that we're proposing and the negotiating. And I have to tell you, Nancy Pelosi is a pretty darn good negotiator, so I'm hopeful.
Well, we've been pleased with all that you've all done there in Washington, and more is needed, and I know you know that, and Speaker Pelosi does. So thank you. I was really pleased to hear you mention two things. One, about helping small businesses that don't have a relationship with an existing relationship with a bank, because you're absolutely right there. And I've heard that from folks here that, hey, I did a good job managing my business. I never needed to have a line of credit. And now I'm sort of left out in the cold because they're putting, existing customers first in line. So that's wonderful. And I love the fact that you're working hard to help our state and local governments as well, because the impact on our budgets is significant, and you're going to hear more about that in the coming days. So why don't we go from there, pivot from there to Senator Fine, and someone had a question about what should we expect of the impact of COVID-19 on the state budget, which was always a tough budget to begin with, as you know. So we'd love to hear your thoughts on that.
It's going to have a major impact. There was just a study that came out today that said in the next 4 years, it could be anywhere from $10 billion to $28 billion. Right now, the governor's office is telling us that estimates of revenue coming into the states are down almost $2 billion in Illinois for the fiscal year. Most of our revenue comes from sales taxes, income taxes, and corporate income taxes. And right now, because of the jobless loss and the number of businesses that have closed down, it's really creating a hardship that's expanding, beyond our local borders, and that's going to hit the state as well. We are, as a legislature now, we're working on this issue. We have formed a number of different working groups to dive into this. It's essential that we do have a budget this year, and we will get that done. We don't know what it's going to look like yet. We're still waiting for more revenues to come in. Our budget group is meeting virtually and trying to hammer out what are the projections and where can we go from here. because there are more places that need the funding now than ever before, because our healthcare system is really taking the brunt of this. Our not-for-profits really need help in order to survive, and our hands are going to be tied in so many ways because of the fact that we're feeling this fiscal impact. So when we go to the drawing board to create this budget, we are going to try to make sure that our priorities are funded as best as possible. At this point, I'm not quite sure what that's going to look like yet.
Senator, can you just share with folks what you shared on the task force call earlier this week about the effect this has on pensions and what you explain to people? Because I hadn't really thought about that, and I thought that was a really important point for people to understand.
So one of the working groups that I do sit on is the pension group. And we are, the pension issue has been a big issue in the state for a long time, and that the pension payment is a large part of our budget payment every year. And so our group is investigating right now, where are the pension funds? Because investments are being hurt all over. So that means the investments of the pension fund are being hurt. So what can we do as a state to make sure that we can still pay those pension payments and still provide for the rest of the budget in the state? So this is something that we're examining right now. We're looking at all ideas across the board. We have a bipartisan group looking at this. And hopefully in the next few weeks, we'll have a better idea of where we can go.
Thank you, Senator. And just there was a question about Evanston and the impact this is having on our budget. Still to be determined, just like Senator Fine said, at the state level. Right now, the city staff is estimating at least $10.6 million shortfall. That seems low to me, honestly, but that's their estimate right now is $10.6 million. Everything from auto tax to liquor tax to hotel tax to amusement tax are all down because of this. I've often talked about changing our tax structure to represent like the modern economy, right? And so the modern economy is ride share and all of that. We've done that, but and that's actually been a good source of new revenue as we've seen other traditional sources of revenue go down. But now no one's even using ride share. So even the modern tax that we moved to is being impacted. It's not an issue just for Evanston. It's happening in municipalities across the country. Our city manager is working with our unions and trying to negotiate creative ideas for cost savings and operational efficiencies. And we're going to discuss that further as a city council on April 27th. Andrew, had a question for you from one of the listeners. It says, I applied for both a paycheck protection plan or program loan and an EIDL, an economic injury disaster loan under the CARES Act. I have not received any answers up to this point. What should I do? And that's from Regina and Dave.
Sure. So I would say that the first thing you should do is stay patient. Congress has allocated hundreds of billions of dollars to these programs because they understand how important it is that we continue to help small businesses like yours continue to operate and maintain payroll and things like that. However, these programs are put together in a matter of days, whereas typically these things take place over many months or years. And so right now the SBA is struggling to come up with appropriate guidance and timelines for both of these programs. With the EIDL loans, we're supposed to have a briefing on Monday afternoon where we will be told what the timeline is for widespread disbursement, how to get frequently asked questions answered, things like that. And when we get those answers, we will put them out to you all on the Congresswoman's newsletter and elsewhere, wherever we can. With the PPP loans, it's a little bit more complex because those are, again, privately administered by SBA certified lenders. And I know that Chairman Nidia Velazquez, the chairman of the Committee on Small Business, has been putting forth all sorts of questions to the SBA and to the Department of the Treasury, demanding answers on how we can keep these accountable, ensure that they're going to small businesses as opposed to savvy businesses that got in early. And we're going to get answers as soon as we can. So we need a little bit more time probably to get definitive guidance on both these programs, but hopefully next week we'll have more information to give you.
Yeah.
If I could just add, Mayor, the sense of urgency that we're getting is universal in the United States. And I think that is going to help move this along. So I really appreciate the question, because everybody is asking it when, and when. And so I think this is prompting as much speed as we can get. So it's important to keep asking.
Congresswoman, have you been serving our state for years, are serving us in Congress for 20 years? Have you ever seen a situation where the federal government has had to stand up so many large programs at once to serve the American people and American businesses?
I've never seen anything like this before at all. We've never had a crisis like this. We had 9/11, and we've had other outbreaks of flus, et cetera, but we've never seen anything equal to this. But I also just want to say that it's been a bit disappointing, the lack of leadership and coordination from the president and and I don't want to say federal government, because I think a lot of the agencies are actually trying their best to make this happen. But we lost some time, that's for sure, before the president really engaged fully. And I'm not sure he's totally there yet, because he's talking like the government can open, the country can open like a rocket, and business can go back. And that's not likely. So this is unique. We've never seen this before.
Senator Fine, Shelley, you just texted us. What is being done to protect our civil liberties? Obviously, we're asking a lot of people, right, with the governor's stay-at-home order. Stay home, save lives. It's essential. But I've gotten this question from people as well about where you draw that line between protecting people and then people's civil liberties. Do you have any thoughts on that?
That's a really good question. Right now, we're all in this for the greater good. And sometimes, just like our Constitution tells us in its interpretation, we have freedom of speech, but you can't yell fire in a crowded building. Sometimes we have to curtail our activities in order for the greater good of society. And we're seeing that now. I have a struggle right now in Illinois and across the country. And my struggle is we are allowing gun stores to stay open, saying that that's a Second Amendment right. But we are saying to churches and synagogues during the holidays, you can't stay open, which I completely agree with, because we can't have these crowds. This separation and this social separation is very essential right now. And so I think that people are getting mixed messages. What are we saying is proper for the public and what's not proper for the public? Social distancing, we're seeing it work. We're seeing the social distancing work because we thought we were going to have a huge spike in deaths this week in Illinois, and it's been pretty flat. Unfortunately, we've seen lives lost, and we've seen families struggle as a result of this. But by telling people that, hey, you have all these freedoms, but right now you need to curtail a little bit for the greater good, it seems to be working. And that's something that we're all struggling with, but we know what we're doing is for the better of society.
Great. Thank you, Senator. And I was on a call earlier today organized by the U.S. Conference of Mayors with Dr. Birx, who's heading up the president's task force. And she reiterated just that point that you were saying, that, all the experts that are looking at all the data are seeing that, the stay-at-home orders and all the sacrifice that everyone is making a difference in the numbers, but we can't let up. We all need to continue to do that, and we should continue to see some positive results come later.
And actually, Mayor, the number of projected deaths has gone down, which is a good thing. The latest number I heard was something like 60,000. That's good. Unfortunately, on Fox News, what they're saying is, well, they say it's because of social distancing, but maybe it's just because this is not a big deal. But even 60,000 people dying is too many. And I want to congratulate people that are observing the distancing and staying at home. And I actually called the police because I'm not going to even mention the park. And I saw a bunch of kids out there playing basketball. And I love kids and I understand it, but we can't have that.
I appreciate you not calling the mayor. Thank you. If you see that out there and you're listening, call 311 or call the police. We do have the police patrolling parks. Again, I think we have the vast majority of people complying with the governor's order, but we all need to do our part. Congresswoman, a question came in from I don't know who this one. Maybe this was Shelley as well. What is being done to get people back to work? We talked about the tax revenues being down and all that. There's a direct correlation between the economy and our tax revenues to run our governments. So if maybe just real briefly, you could hit on a couple points to let Shelley know.
Well, first, let me say thank you to those people who actually are working. You go to the grocery store, and now, by the way, at the Jewel, they're starting to limit the number of people can be inside, which is a good thing. But there are a number of people out there still going to work every day and taking some risks. But in terms of getting our businesses and our whole community going again, that's the point of the Paycheck Protection Program, because we want to actually turn loans into grants to businesses that maintain their employees, that the federal government giving money to make sure that at the end of the day, whenever that is, although I guess, Andrew, that program is good for 2 months, is that right? 8 weeks? Yeah. So that's part of it. And extending it may be a big necessity as well to make it work. So we're trying to build in these programs that say we understand that at no fault of the employer that so many people are laid off. Now let's protect them from that and get, as soon as we can, get those very individuals back to work.
Thank you. Andrew, a question for you, and this is from James. How can I get the government, my bank account data to allow a direct deposit in order to speed up the process of receiving my $1,200 stimulus? You're on mute, Andrew. Andrew, you're on mute.
Sorry about that. Early next week, the IRS is going to be putting out a web portal where you'll be able to log in and update your bank information so that you can receive your stimulus check via direct deposit as opposed to in the mail, or if you have an older bank account that you no longer use. It's not currently available, but they are working on it, and it will be available next week so that they can start sending out checks by the end of April. So you should be on the lookout for that, and I'm sure it'll be on the Congresswoman's website. Additionally, if you're a non-filer and you want to get this out of the way right now, the IRS just today, I believe, did release a tool where you can put in your information, your direct deposit information, so that you can receive the stimulus check. We'll make sure that that's available as well.
Thank you. Just for folks that are watching, I know there's so many programs, some traditional programs and entirely brand new programs that are being stood up. There's a lot of information. There's no one person that has all this information. And so to some of these questions about some of the federal programs, I just want to put a plug in for the newsletters that Andrew and Congressman Schakowsky's office produces, because they're giving really up-to-date information about the stimulus payments, which I know are on the minds of a lot of people. So this is
let me just say one thing. There are people out there, and I'm sure in our community too, who don't necessarily even have a bank account. It seems like people who are the least connected to the system may need the money most. So that is still being figured out, how to get that. We had a victory because for a while they were saying that people on Social Security were going to have to file a tax return or at least submit something. We managed to get rid of that so that people on Social Security Of course, they have your address, they have all your information. You're going to get your check as if it were through a direct deposit. You don't need that. They know you. You're going to get your check.
Good. Always nice when we make it easier for people, not harder for people.
Exactly.
Senator Fine, we have a question from Mike that just came in over Facebook. What does the stay-at-home order mean from the governor? Is it mandatory or is it just guidance for us all?
That's a good question. It's an executive order, and the executive order tells people they need to stay at home unless they're leaving their homes for something like going grocery shopping, picking up a medication, doing something that's necessary to their everyday life. Now, like Congresswoman Schakowsky said, we do have people who are going to work because they are essential workers. So they need to leave their homes. And the governor is also telling us that, hey, it's okay to go for a walk, to go out and walk your dog, but keep that safe social distance. When we do talk about social distance, I almost feel like we need to change our vocabulary and call it a physical distance, because we have so many people now in our communities who feel so socially isolated. But the social distance doesn't mean that, and I know I've seen this before because I'll be out walking my dog and I'll see somebody across the street and I'll wave and they'll look down. But we need to know that human interaction is so important for our well-being. So we need to keep that social distance and be smart about it and only leave home when necessary, but stay home when you can. I've had people call me and say, well, in this country, they're allowing people who are healthy to go about their business. They're keeping their businesses open. Why can't we do that here? And I think my greatest example of that is on my son's college campus, when classes were canceled on a Monday, and this was several weeks ago, and the kids knew that they were going to be going home. There were a couple of quote unquote healthy kids who decided to have a party, and now there's well over 100 people who have been tested positive for the virus from that college campus. So even healthy kids can get it. And I'm not a medical provider, but I think it's like for every person who's infected, they infect, 2.5 people? So this is something that we have to keep in mind.
Mm-hmm. Thank you. The way I describe it, you can go on the governor's website or the Illinois website and you can find the proclamation. It's 9 pages long. I've read the proclamation, and it's really thoughtful about what you can and can't do. I do think the best way is, again, just that slogan, I think that came out of Chicago, stay home, save lives. The only time you're leaving is, again, you're an essential worker or you're going out to do an essential function, and you are allowed, to go out and exercise, walk your dog. You're not allowed you shouldn't be playing team sports, okay? Anything, basketball, football, none of that's contact. You need to practice strict social distancing, and that's the only way that we're going to be successful.
The other thing is, when you go out, the Centers for Disease Control, the CDC, has now suggested masks. You can make one yourself, a cloth mask to cover. Be sure and take with you when you go out your hand sanitizer. So if you're going to a store and you're pushing a cart, if you're not wearing gloves, you certainly want to not touch your face and put hand sanitizer on. So take those precautions and wash.
Absolutely. 20 seconds. Sing a song. Question for you, Congresswoman Schakowsky. And this is from Dan, when will the universities receive their $14 billion in stimulus funding?
I don't exactly know that. Let me see. I did see something from Dan in my notes. See, Andrew, can you bail me out for a second here?
Sure. Say that again, Mayor. What's the?
It was when are the universities going to begin to see their money?
I don't know that I've seen a timeline for that, but we will definitely find out and make that available. But I don't know that offhand.
So, no, that was it. Let me see. I think. Oh, here it is, Dan. we're trying to determine how the fund. The stimulus package provided $14 billion for colleges and universities. That's probably what you're referring to, Dan. Of that amount, $12 billion is directed to colleges and universities that based on full-time equivalent enrollment. And of course, the other thing is we want to make sure that some money is also going to the students who need some support. But what we know is that the amount of money that's been designated really does fall short of what is necessary to provide the minimal assistance to other institutions of higher learning. And I'm certainly pushing that in Congress, but Andrew is right that we
Absolutely.
don't have a timeline. We don't have a timeline yet, but we'll keep pushing. It's interesting, Dan, I don't know if you work at a university. I have not heard a lot directly. I don't think we have, Andrew, in our offices, but we're going to, nonetheless, it's super important and we're going to work on it.
Definitely.
Thank you. Something I've told people is, this particular disaster is affecting everybody. There isn't anyone that's not impacted by this disaster. No one will be made whole again. I just want to, there's no way that we're going to make everybody whole again. I think a lot of the aid in the programs, again, are trying to help across the board, those most impacted, okay, as well as big businesses that we all depend on, which is lines, and making sure they continue to remain in business after this, as well as all of our small businesses that we.
Let me just add to that. A fear is that there will be some industries, companies that will want to profit. We call it the pandemic profiteering. We don't want to see that. And whatever money goes out, federal dollars, your taxpayer dollars, we want to make sure that nobody is using this as an opportunity to exploit. That's why it's really frustrating and inappropriate that the president fired the
Inspector General.
The Inspector General. It's the third Inspector General, by the way, in a short time that he has actually fired because he doesn't want that kind of oversight. But, we've created an oversight commission. We're going to have an oversight select committee, bipartisan, in the House also to look at that. So everybody needs to pitch in, and some are looking for ways to profit.
Thank you.
And Jan, Mayor, just to butt in, sorry. Betsy DeVos, I guess yesterday, said that she's going to immediately distribute $6 billion of the education dollars. So that's the update that I just got from DC. So
Great.
Good.
Great, we like that. Senator Fine, what measures are being taken to protect our healthcare workers, the courageous men and women on the front lines of this disaster? Is financial restoration being given to hospitals to compensate for their loss of revenue as they've had to prepare for this epidemic? And that's a question from Maureen.
Right. And I believe in the federal package, there's about $100 billion that is going to our hospitals that will provide for funding spent due to the virus. As far as our healthcare workers, and we can't say enough about these brave men and women who are really risking their lives every day so we can stay safe. And that goes along with the last message you were talking about. That's why we need to stay home so they can properly do their jobs for us. In Illinois, we are doing everything we possibly can to try to get enough of the PPE for these workers. The governor's office has been doing an incredible job reaching out to state legislators to reach out to their communities to try to figure out, are there any companies within our communities that do have these supplies so we can hook them up with the state and the state can further provide those supplies for our workers. We know that this is a very trying time. These people are completely overworked. So the state has relaxed licensing to bring other healthcare workers into Illinois from out of state, so we can have other people working and give our people who are on the front lines a little bit of a break. And we are also looking at what else we can do to move other healthcare workers around. In some ways, we're relaxing licensing requirements to bring people out of retirement so they can help these workers as well.
Great. Thank you. Congresswoman Schakowsky, here's an interesting question from Adina. Can President Trump use emergency powers to cancel or postpone the November election? If so, what can be done to prevent him from doing that?
Well, actually, Congress, if the date of the election were to be changed, there would have to be a vote in Congress. So I think the answer is a clear no, that he couldn't change that date. Although who knows, he may try. But the answer is no. The Constitution itself says we have to swear in the next president on January 20th of next year. So that is in the Constitution, and he cannot do that. And beyond that, it sort of raises the question about voting, and we want to make sure that we make it as easy as possible. And one of our goals right now is to get universal vote by mail, so that people don't have to leave their homes everywhere in the country. But no, we are going to insist on an election. And maybe, and hopefully not, it'll have to be by mail. I think we should be all right to go to the polls by then. And that is one, when you ask about civil liberties and, just the freedom in our country, this is a must, and that is not negotiable. And we have a majority in the House of Representatives. That's not going to happen. We will be able to vote on November 3rd, and we'll have a president sworn in. I said a new president.
I'll get ahead of ourselves.
I hope on the 20th of January.
Can I add to that, Mayor Haggerty, as well, that voting is already a discussion that we are having in the state legislature. How do we make voting in November easier and more accessible for people to be able to cast the ballot? And my guess is it's going to include things like increasing mail-in ballots. Are we going to take a look at, do we need to have more early voting so there are not crowds at the polling place? Are we going to have our regular polling places on election day in larger sites so there's more space between polling places and we don't have to worry about recruiting as many election judges on election day? So this is a conversation that we're having at the state because we want as many people as possible to be able to access the polls and practice the rights.
Great. Thank you. This is for you too, Senator Fine. We just got a question in from Bonnie. Did the governor extend the date when taxes are due?
Yes. So the governor extended the date to match the federal date. So the tax deadline now is in July.
July 15th. July
15th. Yes. And for people who have already filed their taxes but now can't afford to pay their taxes at this moment, you don't have to. You can call our office or email our office, and we can give you the information about the website that you can go to in order to hold off that payment.
Great. One other question from John related to the state government, Senator. All of government cannot be possibly working on the virus. A lot of government is, I know. What else is our government working on while we shelter in place? Is this a good time to repair roads and sewers? Can you give us an insight on that? And then I'll give a little insight at the local level as well, what we're doing.
Absolutely. So the government is still working. When it comes to road projects, our road projects are getting underway. And now is a good time because there aren't nearly as many cars on the road, so we won't have the traffic backups. But spring construction season is underway. Also, many of our state departments are still at work. We have our children and family services providers who are still doing their visits, doing their outreach. DCFS is still working. We have many essential state employees who are continuing to do their jobs, even in a risky health environment. We are still having home visits. We are still taking care of our seniors. We're still doing absolutely everything we can. As far as the legislature, we are constantly in meetings, be it the group meetings in the Senate right now. We have a number of different working groups focusing on different issues that are looking at, not necessarily what's happening now with the virus, but how do we prepare for what happens next? Like I had mentioned, we're looking into pensions, the budget. I'm on affordable health care. That's another issue that the state's looking into right now. So these are all different ways that the government does continue to work for you. And I want to add that Congresswoman Schakowsky's office, my office, our staffs, although we're sheltered at home, we're still working. Our phones are still working. Our emails are still going. So anytime anybody needs help with anything, please reach out to us because that's what we're here for.
Thank you, Laura.
Thank you. And at the local level, lots of critical work still needs to go on. The threshold that we've used is, can it be done safely? Can people practice strict social distancing? So lots of the work of tree trimming is going on. If you go downtown, there aren't any cars downtown because all the businesses are pretty much, many of them are closed, but we're taking advantage of this opportunity to do lots of tree trimming and things that are invasive and sort of not convenient for our residents that we can do now. One of the questions that I get a lot is, would you stop street cleaning, street sweeping, because we're all at home. And the issue there is one of the other critical pieces of infrastructure are our sewer systems and our water systems, and we need to maintain those. And that's actually one of the reasons, not just a beautification of streets, sweeping the streets, but it's making sure that those remain safe and clean. So we do need to continue to do street sweeping. Congresswoman Schakowsky, have you been in any briefings, and is there discussion and people working on a sort of a nationwide plan, or is this going to be state by state, how we come out of this, what the graduality is of it, and that it's a really smart informed plan?
Actually, we can't do this state by state because people travel across borders. And even those states where we know that we're bending the curve and things are getting better, it would be very risky to just start everything back up again in that state because we don't have borders that can't be crossed. But I do know that we are making plans too. We have a infrastructure bill that we are anxious to, we're anxious to get to the recovery stage, not just the emergency response stage. And we want to invest in green jobs. One of the benefits, I don't want to say benefit, but one of the side effects of the shutting down of governments pretty much around the world and activity is that the emissions have gone down hugely across the world, and our air is much cleaner. We don't want to blow that. When we do an infrastructure project and put lots of people to work, we want to do it in a green way. But I do think it's important to understand that we have to do it together. So even people in states that are doing better should not be pushing faster than some of the other states, because otherwise we could be starting all over again, which would be horrible.
Great. There was a great article in the New York Times today by a bunch of experts in terms of how will we know when we're ready to reopen, and there were 4 criteria that I thought I'd share with people. One is hospitals in states must be able to safely treat all patients requiring
Right.
hospitalization without resorting to crisis standards of care. And we're in crisis standards of care right now in many hospitals. 2, all states must be able to test everyone with symptoms, which we're not at that point right now. The state is able to conduct monitoring of confirmed cases and contacts, which we are all doing. We're doing contact tracing, all of our public health agencies. And 4th, there must be a substantial reduction in cases for at least 14 days. We know that's sort of the incubation period of this. So that's a good, if people want to start thinking about, okay, how do we see our way out of here? That was a really a good article. Senator Fine, what mental health resources are available for residents during this difficult time? We've talked about this at the mayor's task force meetings that I have twice a week. I've just brought on a couple of mental health professionals who are leaders here in the community, so we don't lose sight of that important sector. And I personally, I know many other people are worried about people's mental health at this time.
Absolutely. I've had a lot of conversations with different mental health organizations, and one great concern is in a time of crisis, we want to come together. And right now we're told, we're in crisis, but you can't come together. So not only are we experiencing mental health issues now, but we don't know what the trauma is going to be as we move forward. So in Illinois, the governor has signed an executive order to allow insurance to pay for telehealth. So people have access to their psychologist, to their psychiatrist through telemedicine. And that is a huge help. Ironically, this is a bill that I had been working on in the Senate before the crisis came out. And so now I'm hoping that this is a bill that will easily pass because people are getting the services that they need because of telehealth. We are also extremely fortunate within our communities because we have groups like NAMI, the Family Service Center, the Jocelyn Center, that are providing group sessions via Zoom. Or, you can contact them and set up a one-on-one session. And these are essential. Mental health is the same as physical health, and you can't have one without the other. So we have to do whatever is possible in order for people to be able to reach out and get the services that they need.
Laura, NAMI, what is that? The National Association of Mental
Illness.
Has a hotline, doesn't it?
Yes, they do.
I don't know it offhand, but I think if you look up on NAMI, so if someone is really in a crisis situation, suicidal, there are hotline numbers to call, and it's very important to do that. This is definitely a time where isolation can exacerbate existing problems, mental health issues, or create them. So, try and seek some help.
Yeah, and Jan, that hotline, if you're interested, it's 1-800-950-6264.
Thank you, Andrew. I had just had that handed to me as well, so perfect. Congresswoman Schakowsky, Barbara just texted or messaged us. I am a substitute teacher. Am I eligible for unemployment?
I believe, again, I'm going to turn to Andrew, but I believe that she would be eligible for unemployment insurance. Am I right, Andrew?
That's my understanding as well. But if you can get us her information, we can talk to her directly and try and connect her with someone that can tell her specifically for her case. I think she qualifies them.
We'll put a note on that message on Facebook in case she's not watching. That she can do that. Let's see, a couple questions that folks had of me. Will city employees be allowed to wear their own N95 masks if they serve the public? All of our logistics team at the Emergency Operations Center, and it's a still picture, but that's the center behind me. If you can see that, we have a logistics team that all they are doing is making sure that we can get our hands on PPEs for our own emergency responders, but also as sort of an emergency backup if we need it for congregate care living facilities here in everything. And that team is also supplying our workers with masks and other PPEs. The CDC guidelines or recommendations is that the N95 masks, which is a very specific kind of mask, be reserved for our healthcare workers and our emergency responders. So those are pretty much reserved there, but our other city staff are being offered masks that are out there doing work. And as the Congresswoman said earlier, CDC's recommendation for all of us now is when you are out in public to wear a mask. Okay, and it can be a cloth mask. It does not have to be the N95 mask. Congresswoman Schakowsky, John emailed and said, I have read that air pollution, and you touched on this just a second ago, but if you could elaborate, I have read that air pollution and greenhouse gas emissions have gone down substantially during the shutdown. What are we or can we use this incredible, quote, stop and place moment to make some serious decisions about fighting climate change? Aren't we going to have to make some similar sacrifices if we are to make real progress in that area?
Well, we are certainly, as I said, going to push a major piece of legislation for infrastructure improvement in our country, which, as you well know, boy, I get calls from mayors throughout the 9th Congressional District on all kinds of projects that are needed. But so many green infrastructure projects could be done when it comes to energy, in particular. Unfortunately, the president is still talking about oil. But I think that now most people in this country and even in the private sector, we're looking at investments now that we ought to be helping. That we are still subsidizing the fossil fuel industry to the tune of some billions of dollars every year. It's kind of inherited, and we should be stopping that. But at the very least, we should be putting real investment into all of the alternative energy sources. And as he said, what can we do to capitalize on this moment? Perhaps one of the only really bright spots of the last few months, and build on it from there. And I'm sure that people in many cities are enjoying the idea that they can go outside now and really breathe some clean air. And so I'm hoping that we'll also have the public behind us to maintain that.
I've never heard the birds chirp so loudly.
Isn't that true?
It's true. It's true. Of course, we are entering springtime and the birds are coming out. We've got time for one more question for each of you before we wrap up. So, Andrew, let's go with this question for you. This is from Joanna. If I resign from my job, can I get unemployment?
I think that the question is, if she's is she resigning from her job for medical reasons? Is she a particularly?
She doesn't tell me.
Okay, I think that,
right.
that's pretty fact dependent. I think that it would depend on if she was unable to work because she was in a highly susceptible demographic. Maybe she had, she was a cancer survivor or something like that, and she was unable to do her job because of that in light of the current pandemic. That might be something, but I think we would need to know more.
She actually just got back. It was, and I could see this happening with a lot of people. It was because of childcare, right? We don't have the schools right now. She doesn't have childcare, so she had to resign her job for that reason. And I have to imagine she's not alone. There are a lot of people probably in that situation.
Yeah, I think that she would likely qualify. I think, again, give us her information. I also think that her place of employment, depending on the size of it, they may have to have provided some sort of paid leave if she had to be home to care for her kids.
If I could just add this, I think that this pandemic has demonstrated so many holes in our system, and two here are paid leave and also childcare, which have been problems that have been with us before this for decades, and now this is again perhaps an opportunity for us to fill a hole that we know exists for so many people in this country. We have to have affordable childcare, and we have to have really adequate paid leave for people. Those are definitely on our recovery agenda in the Democratic caucus.
Great. Senator Fine, the state of Illinois extended the deadline for renewing license tags that were due in March. Has there been any consideration to waive this year's requirement for an emissions test? And this is from Sure.
I've not heard that yet. That's something that I can look into.
Okay, thank you. So let me end with one question, and I'm going to ask this of, we'll go with you, Senator Fine, and then Congresswoman Schakowsky. This is a difficult time, an uncertain time, a painful time for everyone. If there's a silver lining right now, what do you think it is? Let's start with you, Senator.
I'm sorry, could you repeat the question? I lost my connection.
Oh, I'm sorry. I said this has been a difficult and a painful time for everyone, some more, even more so than others. And yet, out of bad, comes some good. And do you see from where you sit, like a silver lining of how things could be better in the future because of what we're going through right now?
Oh, absolutely. I'm an eternal optimist, and I really feel like we're going through something now, but something good has to come of it. And as Congresswoman Schakowsky said, we're really going to look at what our priorities are in the state and in the country and make sure we focus on those priorities. And many things we're seeing right now is, how do we care for families? How do we care for the most vulnerable in our communities? How do we make sure that everybody has access to health care? So these are things that we're really going to take a look at and improve upon. And so in future generations, positive is going to come of this, because we're going to learn from what our mistakes were in the past.
Thank you, Senator. Congresswoman?
I think on a personal level, at least at first, I think people are going to be so happy to be able to be with their families, to appreciate what it means to be able to be physically close, to be able to depend on one another. And so I think there's just going to be a lot of psychological goodies to come out of this. But I think we now have seen what unprepared looks like. And there's, you've had a lot of experience with FEMA and emergency management, but obviously we just were not anywhere close to prepared for this kind of pandemic. And, it's not necessarily the last. And so we need to be prepared for the next. And I think we will be.
Great, thank you. And I would say for me, one of the things that I think is positive about this lousy and terrible experience that we're going through is it's shown how integrated we all are, no matter what our profession is. I love that essential is, childcare workers that are taking care, right, of our emergency responders and our healthcare workers. They're the baggers and the checkers at the grocery store. And then they're on the other end, right? They're these incredible smart scientists who are trying to develop a vaccine for this. And the folks that are in forecasting and modeling and where's this going to go. I just think that that's a nice message for all of us to remember, that no matter what we do, it's important collectively for all of us. So I want to thank all of you, all four of you, for spending some time with the residents of Evanston today. I appreciate all the support that you've given us here locally. We know you're strong advocates for us, and be safe and be well. I know there were questions that we just didn't have time because we allotted an hour. We didn't have time to get to every question. We'll continue to do this here in Evanston, where we do weekly coronavirus frequently asked questions and try to get those answered. So, and
call us if you have something. We'll help you. Yeah,
absolutely. Thank you for watching, and be well, everyone. And remember, stay home, save lives.
Thanks.
Thank you.
Thank you. Happy Easter, happy Passover, happy Ramadan coming up.
Exactly. Bye, everyone.